Welcome back to Psychologist Reads. I am Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist and an ASEC-certified sex therapist. To continue our Pride Month readings, today we'll be reviewing a segment from the Handbook of Counseling and Psychotherapy with lesbian, gay, bisexual, and transgender clients. Okay, so here's the thing. I got this book in 2014. It was published in 2013, but I got it in 2014 when I was in North Carolina for my internship because I was serving as part of the transgender care team there. The book reviews various clinical concerns that are impacting the LGBTQ+ community, as well as really teaching and training new clinicians on how to provide affirmative care to this population and really being able to emphasize and ensure clinically responsive care. Let's dive into some readings. Okie dokie. So we're actually going to be reviewing the chapter by Connie Matthews, which is Affirmative LGB Counseling. We're going to be reading the section about heterosexism and the therapeutic relationship, how heterosexism works. Heterosexism has been defined as the ideological system that denies, denigrates, and stigmatizes any non-heterosexual form of behavior, identity, relationship, or community. In this 1995 study, Herrick explained that there are dual and mutually reinforcing processes operating within heterosexism. Firstly, heterosexuality is considered the norm to such a degree that any alternative perspectives are left invisible. Second, when gay, lesbian, bisexual, queer, or other orientations do become visible, the consequences are prejudice, discrimination, and stigma. It is important to keep in mind, however, that such overt hatred and persecution are not necessary for heterosexism to be present, according to a 1996 study by Brown. It is also critical to remember that heterosexual counselors are not the only ones who need to be aware of heterosexism. Because we have all been raised and live in a heterosexist culture, LGB counselors can also be subject to that culture's influence. The psychological literature has begun to address the implications of the assumptions of heterosexuality for LGB individuals. Assumptions of heterosexuality refers to the premise that all people are heterosexual unless and until they indicate otherwise. As the anecdote at the opening of this chapter points out, therapists frequently operate under this premise, including many therapists who otherwise work to practice affirmatively with clients they know are gay, lesbian, or bisexual. Although the intention is not usually malicious, assuming heterosexuality prior to discussing sexual orientation with the client is a biased and ethically problematic practice because it is harmful to clients. Assuming heterosexuality marginalizes gay, lesbian, and bisexual individuals by forcing them into the role of other. Furthermore, assuming heterosexuality places the burden of disclosing this otherness on the gay, lesbian, or bisexual individual. Given the discrimination and prejudice that exists in society, such disclosure always represents some level of risk for the individual. When therapists assume heterosexuality, they reinforce the marginality that LGB clients experience and add turmoil to the therapy process by forcing clients to either keep an important secret or take a significant risk in raising the issue of sexual orientation. Thus, it is vital that all counselors remain open to the possibility that any client who walks through the door might identify him, herself, or anywhere along a broad continuum with respect to sexual orientation. In addition to recognizing that all clients are not heterosexual, it is important to remember that gay and lesbian are not the only alternatives. Bisexual individuals frequently experience additional invisibility when therapists assume heterosexuality or homosexuality based on the gender of the client's current partner rather than exploring further. It is also important to understand that a client's current identity may not be a fixed point, but rather may be more fluid over time. In addition, it is important not to make assumptions based on current behavior or marital status. In her investigation of the reactions of gay, lesbian, and bisexual people in the anti-gay amendment passed by voters in Colorado in the early 1900s, Russell found many bisexual individuals who were in mixed-sex relationships reported that they were not open about their bisexuality because of safety concerns. Therapists must provide opportunity and a safe environment for clients to share such information. So, there's a lot more in this chapter and a lot more in this book. What really stood out to you? What were some of the reactions that you had as I was going to review it a bit? One that really stands out to me, and this is something I do very regularly in my practice, I try to ask very open-ended questions about sexual orientation, romantic orientation, gender identity, instead of going, oh, ... or your partner is a ... Really looking at the importance of open-ended language and us as the clinicians being the one to prompt it, even on our informed consent documents or patient information sheet, not having a drop-down menu that limits the options, but having it more so be just a fill in the blank, however the person identifies. But that can be really intimidating and very scary for individuals, particularly because they don't know us. They don't know what our orientation is. They don't know what our training is. They may not identify us as safe people. So there are things that you can do to provide a safe space, even by, for example, having Skittles. One of the first things you see when you walk into this office. Even just how you ask questions, what your office looks like, even any appearance you might present, it is going to send a message to patients to ensure that they feel safe enough to disclose if you haven't been the one that prompted it. So this one is a very textbook heavy. This is a textbook. Cites a lot of different articles, a lot of different resources. Luckily, we should have another edition because this is, again, since 2013, so we are 13 years old at this point. It does have some additional information that we've had since that time, but this one is a really great example if you're looking for more of a textbook-oriented reading. So, what should I read next? Feel free to put your recommendations or suggestions or even thoughts you might have in the comments down below. And remember to like, follow, and subscribe for new readings every Wednesday. I'll see you then.